For kids and teens living with anxiety and OCD, the idea of going to school or being in a classroom can present some of the toughest challenges that they need to face. Young students with OCD, for example, might feel compelled to repeatedly check and recheck their work, getting stuck while other students have been able to move on. Young people with social anxiety, meantime, might struggle to participate in group projects or make friends, leading to their being bullied or ostracized. Over the next 75 minutes, we want to explore how teachers, parents, and healthcare professionals can all work together to create safe spaces for anxious students, reinforcing actions that will help students thrive and avoid engaging in actions that aren't related to positive outcomes. And to that end, we have invited two experts to join us. Dr. Abigail Stark is a staff psychologist at McLean Hospital and works at McLean's Anxiety Mastery Program, an intensive exposure based outpatient program for young people with anxiety and obsessive compulsive disorders. Dr. Yudelki Firpo-Perretti is a clinical psychologist who runs McLean's school consultation service and specializes in evidence based treatments for anxiety and OCD, including cognitive behavior therapy and exposure and response prevention. Abby and Judy, thank you both for joining us today.
Thank you so much for having us.
Well, we're thrilled to have you both with us. Abby, I want to start by asking you to describe the spectrum of school-related anxiety challenge that young people often face, both at home and in the classroom itself.
So at the McLean Anxiety Mastery Program, I think school is one of the top things that we hear is the kind of hotbed of anxiety. There are so many different things that can come up going to school that really provokes anxiety. And school is such an important way to gain exposure to these different things. It's a vital part of growing up and developing. So some of the top things that we hear come up, many kids, and this is pretty developmentally typical for kids and teens, worry a lot about judgments from their peers, from other people, and when that worry about judgments, embarrassments, things like that start to reach a point where it feels hard to be yourself, ask a question, make a new friend, sit down with people at lunch, it can start becoming really, really interfering. And I think that piece with the social anxiety that you had mentioned before, Jeff, is such a big piece of the school-based anxiety. Since there's so much uncertainty, we can't control it. Parents can't control it. Therapists can't control it in terms of like all what other people are doing in the moment. And then we also see a lot of perfectionism, worry about academics. The school has rigorous demands, and when you struggle with anxiety, not only getting through the school day, but also performing, learning, being able to activate those parts of our brain that are involved in kind of higher order thinking when you're feeling anxious at the same time can be so challenging. And then coming home and doing homework afterwards and all those different things. And like you had mentioned before, Jeff, there's also with OCD, so many different ways that OCD can come out in school. We like to think of OCD and anxiety as really hating anything that it can't control, and uncertainty, things like that. So if you have contamination concerns, intrusive thoughts, all these different, this whole spectrum of OCD, a lot of it tends to come out in school. And then,
Judy,
go ahead.
I'm sorry, go ahead, Abby.
I was going to add separating from your family, being away from home. There's all these different ways that anxiety can come out in the school-based environment, and then extracurriculars that are tied to school too.
Great, thank you. And we're going to circle back and talk more specifically about some of those challenges that you've raised as well. Judy, if you would help us with some perspective here, how common is school-related anxiety?
Well, that's a tough question because, as Abby just pointed out, the anxiety about different areas involve, like a lot of different areas involve school, right? So, we know that up to 30% of youth experience symptoms that are consistent with an anxiety disorder. And those are all going to manifest in a number of different environments, including school. And for some kiddos, that anxiety, the intensity of it, and the interference impacts their ability to even attend school. And that tends to be a smaller group of kids, but it still is running on a continuum of like these symptoms will affect their ability to engage in meaningful ways in some way or another in the school environment, be it the academic expectations or their friendships or extracurriculars.
Great. Thank you. Abby, let me circle back to you for a moment here and take a slightly deeper dive into some of the classroom specific challenges that K-12 students face when it comes to anxiety. Talk a little bit more about social anxiety in particular.
Yeah, absolutely. This is something I feel very familiar with. Since so many of the teens and kids that I work with report social anxiety symptoms. And I think, like I was saying before, that when you're someone who's sensitive to anxiety, especially as you're getting into those teenage years, your peers matter so much to you. That's developmentally typical. And when you also have that sensitivity to anxiety, we tend to over focus on it and become really wrapped up in these fears of judgments, embarrassment, doing something wrong. And this can also occur not only with peers, but with teachers as well. What do teachers thinking of me? Asking for help, being able to take a break, things along those lines. And so the ways we tend to see social anxiety going from the more typical levels into what we call more clinical levels, like when you'd want intervention, is when you're feeling like you can't share an opinion, you can't advocate for yourself, having trouble speaking in front of other people, noticing symptoms of panic, like a lot of really intense physical symptoms of anxiety when you're in social situations. And we know for so many kids, social anxiety stops them from interacting with other kids, stops friendships, which is also tied to things like depression, lower mood, kind of feeling like your world is getting smaller because of anxiety. So I see working on social anxiety as such an imperative piece of just making those connections, helping with mood, helping interact with the world around you.
Judy, you're nodding your head. Anything you want to add to that in terms of social anxiety challenges in the classroom?
Well, that Abby was mentioning a lot of these physical symptoms, and that is something that teachers will often see as like almost like a primary indicator that a kid is struggling. And kind of cueing into that for kids that suffer from social anxiety that may have like performance issues, it may also be connected to physical symptoms that often present in the classroom. And that's true for other anxieties, other forms of anxiety disorders as well. I think like with social anxiety, it is so pervasive, which is part of why it's being highlighted, especially as kids are going more into the teenage years and the stakes do feel a lot higher. If they misstep, if they have toilet paper on their, shoe walking out of the bathroom and the implications of that. The weight, the pressure that teens experience around peers in also identifying or figuring out really who they are, it all adds to this picture of social anxiety. And it is important to note that we're talking about a continuum, so it's not uncommon. You're going to see kids that struggle with, the cliques in high school, or finding their way, or participating in different activities or in particular classes. And then there are those kids that fall deeper into the spectrum of struggling. Yeah.
And Abby, what about some of the hidden symptoms that might be really difficult to pick up on? I'm thinking about OCD, for example, and
Mhm.
it might be that a teacher thinks that Johnny is having some learning difficulties because he's taking so much time to fill out his test results. When
Mhm.
in fact there might be some OCD checking involved, or just right OCD, for example. Can you speak to that challenge of recognizing some of these more difficult to perceive symptoms?
Yeah. I think that even for a therapist like myself who specializes in OCD and anxiety, we have to get curious. We have to ask questions, and so many kids are good at hiding. So many adults too are good at hiding the things that we might feel shame or embarrassment around, and not letting other people see if we're struggling, if OC is going on. And a lot of times when teachers and others think of OCD, we think of hand washing, like the things that we see on TV as more stereotypical OCD, which it totally can be around contamination, cleanliness. And like you mentioned, Jeff, indecisiveness, making decisions, rewriting, rereading, feeling this just right feeling of I have to have this perfect and do it over and over again until it feels just right. There are so many parts of OCD that take up so much time and make it incredibly difficult to answer one free response question or something like that on homework. And so, what might look like this child's not engaged, they're not doing their homework, they don't care, could actually be that they care so much and are really stuck. I think of OC as getting us super stuck.
Judy, what should we know about perfectionism as it's relevant to this conversation about challenges in the classroom for students?
Yeah, yeah, and that is tied to in part what Abby was just talking about around OCD. You also see this with kids that have those excessive and uncontrollable worries, kind of more of the generalized anxiety type of presentation. One of the things about perfectionism specifically is that we all find value in it. I think like we have a culture of like wanting things to be of a certain standard, and for some kids, that standard is such a high standard that is unachievable. And also tends to be one that relies on external validation, or is heavily tied to their identity. So what you'll see in kids that struggle with perfectionism is both the like the checking behaviors, so wanting to make sure that things are right or that they got that 100, or even like resubmitting assignments and checking to see if they did well, between when they submitted and when those exams or papers are to be returned. But what you can also see, and which is not spoken about as much, is that procrastination that can often be tied to perfectionism. And it seems counterintuitive, but it's more in line with like this black or white thinking. If I cannot do this just right, if I cannot get this at 100%, what is the point? And there's a delay in then attacking, or I shouldn't say attack, but like chipping away at the assignments or the expectations, again because of this perfectionism that can get in the way.
Abby, what do we know about how excessive anxiety impacts a student's ability to take in and process information? I assume some studies have been done about that?
There's actually an abundance of research on this, both from like naturalistic studies of how students do when they have higher anxiety, and even things that are more like fMRI studies, like when we make someone anxious in an MRI machine, what does their brain do? And what we know about anxiety, and this is evolutionarily adaptive, so our brain's actually doing what it's supposed to do, is that when we feel anxious, our sympathetic nervous system, that fight or flight system goes off, and we're not supposed to be able to analyze Shakespeare or be able to do a complex math problem. We're supposed to keep ourselves safe in that moment. So, like back in cave person days, if a mountain lion jumped out, you don't need to think to yourself, this is my lack of mountain lion knowledge. It has its shaggy winter hibernation coat or something like that. You just want to react. You want to get out of there or be able to fight that mountain lion. Modern days, a lot less helpful if you're sitting down to take the SAT and your brain's basically having this fight or flight reaction. It makes it hard to concentrate, hard to use executive functioning, planning, advocating for yourself, all those kind of higher order types of things that then can also increase anxiety because then your mind's going blank and it feels harder to think straight and all these different things. So it can be a cycle along those lines.
Judy, I want to ask you about self-awareness and perhaps especially in younger students. It can be really tough for a kid to articulate what he or she is feeling in any situation, let alone a tricky anxiety-related situation at school. Can you speak to that particular challenge and what parents, educators, and clinicians might do to kind of facilitate that communication?
Yes, I'm glad that you're asking that, and also as a follow up to what Abby was just talking about with our stress responses. So with younger kids, they often can't identify what it is that they're nervous about or what they're anxious about. And if you think about it, that makes a lot of sense. In fact, like a lot of adults struggle to figure this out. So we wouldn't expect a younger, say, 6-year old or 7-year old to understand what it is that they're feeling. What you often will see with younger kids, though, is that in addition to kind of that urge to avoid, to get out of doing things or to rely on other people to rescue, like say like, "Oh mom, like can you tell them my name because I don't want to say it." You might also see that kiddos show their experience of nervousness or anxiety in other ways, right? So there's the fight response that Abby was just speaking about. You'll see that also in teenagers. This is the kid that when they're feeling overwhelmed and they cannot identify often exactly where this is coming from, they might respond in the form of yelling or an outburst or, what seems to be a kid being stubborn or oppositional. When in reality, what you're seeing is a kiddo, either a very young kiddo, like you were asking about, or even teenagers who isn't quite able to make a lot of sense of what's going on or is seeking ways to control the environment in other ways. And those tend to be the kids that are more misunderstood, right? The ones that cannot verbalize or lack the awareness about their experience. So then for teachers, I think it does call for more of that patience, that curiosity, that non-judgmental curiosity, and sometimes also being able to make a few light guesses about what a kiddo is feeling, right? So, oh, I see that something changed right now. It seems like you're a little bit more tense. I'm curious, are you feeling a little nervous? And those gentle guesses can start to help build up awareness, in particular for younger kids.
Abby, did you want to add to that?
Sure. I think that for so many kids also with anxiety, they push away or avoid emotions because they don't want to feel these big emotions. If you ask them what they're feeling, it's like, I'm fine. I don't know. I don't want to talk about it. Even if they have really notable anxiety, not wanting to go back and discuss it. And so being able to practice checking in, discussing what's going on. At the clinic I work at, we do mood checks a lot. Some of the kids start to get a little annoyed with it. And we like to say it's like we checked in with our own emotions as much as we checked our phone, for example. We would just have such greater awareness of what's actually going on for us. And like Judy said, just to echo it, even as an adult who's also a psychologist, sometimes I don't realize I'm anxious till the end of the day and my shoulders are up to here and I'm irritable with the people around me. And so being able to check in and practice fostering that awareness and thinking of emotions as something we all experience, not a negative or a positive, and being able to practice noticing and identifying it, incredibly helpful.
Before we get into addressing some of the specific questions that are coming in, and there are many, let's kind of finish talking about the overall landscape of these issues around K-12 students and anxiety. School refusal, what should we know about that, the term itself, and how it factors into this conversation? Either one of you want to jump in with some thoughts on that?
So we often will break down school refusal into two main categories. There's school refusal due to more anxious and depressive symptoms, and school refusal, they call this more like truancy, due to more like being out of school for other reasons, such as difficulty attending due to substance use, things like that. I think they're very interconnected. And if you look at the research literature, they tend to divide them up in this way. And one of the things that we see with school refusal or school avoidance is that when kids start to avoid school, the longer they avoid school, the harder it is to get back into school. And so COVID did not help this. We've seen the levels of school refusal and avoidance increase since the COVID-19 pandemic. And in terms of my clinical experience working with school avoidance and refusal, it can be a long process that takes a village, working with a lot of different people involved, teachers, parents, a therapist, and a step-by-step process. We use a lot of exposure in this process of slowly reintegrating back in school, just given there's so many different pieces of this that can, specifically for anxiety, trigger anxiety from the academics, social piece, meeting with teachers, walking through the door. There's a lot of different pieces to this puzzle.
Well, I wanted to add a little bit more about the idea of like school refusal. School refusal continues to be the language that is used. Now, the word itself of refusal, it has its own implications. So the act of being absent from school is fully coming from will. And so there has been a shift in the language so that we're really talking more about like chronic absenteeism too. Like what we're saying is due to any number of reasons, kids are absent to a degree that is impacting their growth and development, be it socially or their education, or in other ways. So they're absent that much, and it typically is because of any number of reasons. So in part of what Abby was talking about, this prolonged process and trying to help kids re-enter school is really trying to get a good understanding of like what are the root causes. And what you find is that yes, of course, it's like there are those mental health related issues like depression, anxiety. There's truancy where you might see more of those externalizing behaviors, also tied to mental health symptoms, but that often gets ignored. Um, and there's the ecological piece of this. A lot of families where there is, where you see this chronic absenteeism, a lot of families are struggling to get the resources, the connections, even struggling with the sense of belonging to certain school environments. There are a ton of factors including even acculturation and beliefs and values that can play a part in this greater picture of one child, even that is struggling to attend school or attend their classes.
Mhm.
Relevant question that came in here. Let me work it in right now. I believe this is from a teacher. For children who have chronic school absenteeism, how do you educate parents about accommodation? And if I'm reading this question correctly, I think they're talking about inadvertently exacerbating the issue by accommodating perhaps more than is healthy. If that's my take on the question. Abby, can you weigh in on that?
So we work a lot with caregivers around this accommodation piece with school avoidance, since it almost always is a piece of the puzzle of helping parents figure out how do you gently push and help your child take those steps to get back into school. And so typically, a lot of the parents we work with just haven't really learned about the anxiety avoidance cycle, that when we're anxious, the urge is to avoid, and that the more we avoid things, the more anxiety grows. And so it is a natural protective urge in caregivers and people who care about any child, to want when they're feeling anxious to help them avoid, to get them away from the thing that's making them feel anxious. When I'm working with a child in therapy and we're just practicing doing an exposure, like giving a presentation when you're anxious, I know I notice the urge in myself of being like, let's do this tomorrow. This feels really hard right now. And I also know that that just was going to make it even harder the next day. So I think at baseline, step one is teaching parents about this anxiety avoidance cycle, and that when we accidentally or inadvertently are helping a child avoid, we're actually making anxiety bigger in the long run. And I think it can be then, as a second step, really helpful to make all plans about reducing accommodation in conjunction with the child there. They may not agree with them fully, and make sure we all understand that, let's say, parents take away cell phone if you're staying home from school that day because anxiety is too high and you are a 15-year-old that cannot force you out the door into school. That the child understands this is not because we're trying to punish you. This is not because we don't believe you that you feel miserable. We're trying to make home a little bit less comfortable because we want to make school a little bit more reinforcing, and being able to talk with this together as a whole, having everyone on the same page with the plan.
Judy, generally speaking, what are some of the common co-occurring mental health challenges that are associated with school anxiety? Are there particular conditions and disorders and challenges that stand out to you?
Yeah. So social anxiety, you'll see that as being, and actually, I should clarify that school refusal is not in itself a diagnosis. It's more speaking about the behavior, the absences of school, and it's coming typically from social anxiety. You'll also see it a lot with GAD. The truth is, though, that it could be any number of mental health disorders that lead to that presentation of being absent from school, primarily due to mental health related concerns. But those are at the top, I would say, social anxiety and GAD. Yeah.
Abby, anything you want to add to that?
I think, just to echo Judy, that anxiety leads to avoidance for most of us evolutionarily makes sense. Modern world, sometimes less so. And so with all these different anxiety disorders or OC disorders, the urge to avoid is really strong. And like we started off by saying, school is just a wonderful and important thing and has a lot of sources of anxiety. And so it makes sense that it's one of the things that kids will start to try to avoid because of anxiety.
Yeah.
Well,
That, sorry, just to add sort of like that, that also highlights how for kids, their primary job is school. It only makes sense that that is what anxiety is going to latch onto. That is what OCD is going to latch onto. Typically, when we struggle with something, it's because it's really meaningful for us. If we kind of think about it that way, like, well, it makes sense that you're seeing a manifestation of anxiety that is so interfering in their primary job. And then as kids get older and they have, they have part-time jobs, or they're expanding the domains in their life, you'll see that manifestation of anxiety present itself also in other environments.
let's move into some specific strategies that can be employed here to address the issues of anxiety, around anxiety, I should say, in schools. We've got three distinct groups here. We've got teachers, we've got healthcare professionals, and we've got parents in addition to the students. I would imagine that top of the list in terms of key strategies would be communication. Am I right?
Mm-hmm. Yeah, I 100% agree that communication is not only important, it's critical to be able to support a kiddo in a way where interventions are kind of broadened, not just like in one, like not just in school or not just at home or not just in the community. And from my experience, what often comes up is that there is hesitancy from the part often of families to communicate or just not knowing who to communicate with or what to communicate that is helpful, right? That could be potentially helpful. Um, and to that end, there are any number of reasons that can complicate communication between families and schools. So I do want to acknowledge that. I think that r- reaching out to teachers, and if not the teacher directly, to a counselor in the school, even just to say, maybe you don't, if you want to, you can disclose like diagnoses and treatment and things like that. And if you're not feeling that you're quite ready or that it may not be particularly helpful for your family, at a minimum indicating that your kiddo might be struggling, like, letting them know your kiddo might have a hard time in when they're in the cafeteria because it's very crowded and they can get very overwhelmed, or your kiddo is working on being able to participate in small groups and here are some tips that might be helpful. So even if it's just like opening up the door to a path of communication in that way, just giving them a hint, my kiddo might need a little bit more support here, that can go a very long way.
Abby, where are the lines drawn in terms of communicating some of these challenges? At what point is a teacher overreaching, for example, in sharing concerns about a student? At what point might a parent be overreaching in terms of asking for special accommodations or other considerations for their child? Help us navigate that relationship.
Yeah, it's a great question. And I think it really depends on the severity of the presenting anxiety and how much is impacting things. To me, communication is almost always the answer, that the more we talk, the better. And when we're talking about accommodating anxiety, so let's say a child's been out of school for several weeks. Yeah, it could be helpful to have some of the work excused, and let's make a plan for how to get them in step by step. If a parent is calling in, and their child's missed one day for being anxious, actually having a little extra work to catch up on and having that natural consequence and practicing that may actually be a helpful, step, and we wouldn't necessarily want to say, "Every time you're out for a day, all work is excused," because that may inadvertently reinforce being out. And so I think communication and understanding what is the goal of any accommodation we're doing or any changes we're making, is kind of the most important thing to understand. Like, what is the effect of this? Since, for example, excusing work could look many different ways and have many different goals depending on the presentation, severity, the impact of anxiety in the moment.
Judy, here's a related question from a viewer as well. What do you do if you feel like your child's school or teacher is dismissive or not very understanding of your child's condition?
Yeah, yeah. Well, and that's a tough one, right? So I will say that sometimes it really is a matter of like getting on the phone, and being able to have like a live conversation with somebody, because from my vast experience, most, if not all, people want to do good. Most of, if not all, want to be able to support kiddos that are having a hard time, and often it's that something is getting in the way of that mission, of those efforts, which is why, like, getting on the phone could be helpful if that's possible. And I also think it's important for families to have a good understanding of what their rights are. So, in the States, we have educational rights, and there is a pathway to being able to get psychological assessment for kiddos that can lead to appropriate interventions in school. So I would say that that's another piece of like, and it, of course, like understand what your policies are, and becoming informed about what are your rights, the steps that you can take. And it's usually both. Like I said, most of us, we want to do good, we want to support in the best ways that we can, and it does start with that conversation.
We talk about sometimes safe spaces for creation for school kids. What is that term getting at? Safe spaces.
So safe spaces could be any number of things. I think like a big piece of it is thinking about it more of like an approach to how we help kids understand that they can talk with us, or and if they can't talk with us about like all of the things, that we can at least direct them to the people that can support them. There's also though like more concretely things like calming corners, right? Or coping spaces. Any number of names they have. With that, like this example is really speaking about having an actual space within the classroom and also outside of the classroom, where when kids are feeling very anxious, so overwhelmed that they really just cannot cope, they cannot face what's in front of them, that they can take a little break and use the skill, and what usually within these calming corners there are objects or just like or like mats or like a beanbag or some sensory things that can be really soothing and calming for kids. And if the idea here is that this is used only for like 5 or 10 minutes, and then they're able to return back to the challenge, go back into on their desk, and and address like that assignment that was overwhelming them. Yeah.
I'll just add to that, the idea or the fact that for most kids, school is the place they spend the most time besides home. So they are there for 8 hours a day, 5 days a week, and having a place in school or just the kind of more abstract attitude in school, if this is a safe place where you can go and talk to someone and not have judgment, have people listen to you, whether or not your family accepts certain things about you or things like that, I think is so vital for kids growing up. There's been research that demonstrates that even for kids who face a lot of adversity, having one trusted adult, whether it's a family member or not, can create such a difference in their trajectory and resilience. And so, just this idea as a whole of creating safe spaces at school in the abstract, I think is so important when this is where kids like live half the time, basically. And kids are learning so many things about themselves and their own identity and going through so many different experiences between kindergarten and 12th grade.
I want to shift the focus a little bit here. We've been talking a lot about anxiety around school itself, whether it's school refusal or issues that are related to school. But let's talk about anxiety and OCD in the classroom that may be unrelated to school itself, but becomes problematic because of the setting itself. Um, Abby, let me ask you to talk a little bit about OCD in particular and some of the challenges that might be exacerbated by being in a classroom and things that we as parents and professionals can do to help facilitate that anxiety treatment.
Absolutely. So I think that, like we were talking about before, there are some parts of OCD anxiety that kids, teens, adults are able to hide, and some parts that feel a lot more challenging. Like I'm thinking about a teen I've worked with in the past who had a tapping good luck ritual with OCD, where he'd have to tap things a certain number of times and count to sometimes close to 100 before he was able to move on from something. And it was really obvious to those around him. It wasn't specifically about his schoolwork or things like that. He was worried that something bad would happen to his family if he didn't kind of go through these rituals. And for a teacher standing in the classroom, it looked like this child wasn't leaving, was tapping different objects and taking a lot of time. And how do you talk to the other kids about that while maintaining the student's privacy? Teachers don't always know like what this is or how to talk about OCD. Should they bring it up? Should they not? And so I think all different kind of challenges can come up and questions can come up. And not to sound like a broken record, and I think this is where that communication and curiosity is so key. Like this kid who I worked with knew that people were noticing what was going on. Having someone come up and say, like, "Hey, are you okay? What's happening right now?" Communicating with parents. Does this person have a therapist? Is there a plan in place for when this comes up? I think that can be helpful with the whole range of different symptoms that OCD can present itself with. Since for most kids on the more severe levels of anxiety and OCD, you're going to notice something going on within the school setting, whether or not it's related to the actual work or social things.
Judy, generally speaking, is it your sense that teachers are equipped with the training that they need to recognize some of these challenges in the classroom?
I think that can be really hard for teachers. One thing that's important to remember is how often they have 20 or more kids in the classroom, and teachers have like such a unique perspective of kids. They spend so many hours with them their attention is so divided as well. So even teachers that are very knowledgeable in mental health related symptoms, it can be hard for them to spot it. What you often will hear though is that they will be the first ones to notice a shift in behavior because of the amount of time and the different ways in which they see kids showing up. And that I think is important. That's a very important perspective to have. While it may not clearly be that a teacher can say like, oh, like this kiddo has OCD, right? I actually like teachers are not trained to be able to do that to provide diagnosis, but they can probably tell this kid is not quite himself right now. And that in itself, and like some of those observations of the behaviors can be so helpful to be shared with any mental health professionals in the school and with families as well. Because again, sometimes they teachers will see things that others cannot see. There's also that sometimes kids present symptoms in school that they do not present otherwise. Similarly, the flip is true too, that kids might show, like, say, OCD symptoms outside of school and then nothing throughout the entire school day. But because they're able to kind of keep it together during those like 6 or so hours, they can really hold it in and then they're extremely exhausted. That also is an observation that teachers will see. They will note that exhaustion, the next day or the next few days. They might note also delays in submitting assignments, all of those types of behaviors that are not directly tied to, say, for example, the OCD, but are observations that are very important to have and to share so that kids can get the support they need.
Abby, let me work in another question. This is from a school clinician. I am a school clinician wondering if there are recommended evidence-based groups for teens supporting the management of anxiety and or OCD, which could be implemented in the school setting.
So there's a couple of different like programs like for example, the Unified Protocol and things like that have school-based, evidence-based groups. I would say the main thing to look for from my point of view, in terms of working on anxiety in an evidence-based way in school is something that involves something called exposure and response prevention. So at the clinic I work at, it's all group based. So I work with the teens at this program, and we do exposure groups every day, 4 days a week. So the kids come in, have a lot of these groups, and this idea of exposure is one of the most important pieces of fighting back against anxiety. And so I would, if I was evaluating a group, I would look for that exposure piece. And then in general, cognitive behavioral therapy for anxiety is one of like the gold standards for anxiety and OCD. And so this would involve both exposure, being able to challenge anxious thoughts and work on those different thoughts that can come up from anxiety, learning different coping skills to bring down the intensity of distress, recognizing and identifying emotions, things along those lines. And absolutely, I think groups are great, easier way to work with a bigger number of students at once. And think it really normalizes anxiety and allows people to talk together, and be able to share and relate to one another.
Judy, how does mental health stigma factor into these conversations? Do you find that it gets in the way of constructive conversations between parents and educators and well, certainly not clinicians, but parents and educators in terms of bringing up issues that a child might be dealing with that a parent and or a teacher should know about?
Absolutely, yes. So stigma plays a big role in and outside of school. Like we know that stigma impacts families' willingness to access treatments. Oftentimes, in school, one of the biggest concerns that caregivers will report is how will this show up in my child's permanent record? If I were to reach out to the principal or the teacher or the counselor, what would happen? Would my kid be labeled as, having deficiencies or, this idea of like, will my kid now be a special ed kid? So there's actually a lot of stigma that can keep families even from opting into supports that are needed and for their particular kid. There's definitely an existence. One of the things that I would say that is important to note about mental health is that we all experience some form of struggle with our emotions, with our, what we do, what our challenges are. So more often than not, if families reach out to schools, they're gonna be met with understanding, rather than judgment. To kind of like really trying to encourage again this like open conversation and communication.
I have to ask, you both have been doing this work for a while here. What's the trend line? Do you find that communication is improving around these particular issues of anxiety and OCD and what teachers should know about them?
I do. I think that there's this trend of increased communication and awareness of anxiety and OCD that also echoes a little bit less optimistically this increase in anxiety disorders that we're also seeing, an increase in mental health disorders in children and teens that has been increasing since around like 2010. And so I think it's become almost inevitable as or unavoidable as a teacher or school-based provider to miss seeing some of this anxiety or OCD that's going on. And as a result, communication channels have been opening up more and more. I would say in general, in the area that I work in the US, we have a lot of communication and great work with teachers and administrators. The biggest challenge is bandwidth. Just given teachers are responsible for so much at once. And so there's the desire for communication and how do we not burn people out? How do we create like a sustainable amount of communication when a lot of these kids need a lot of conversation and discussion?
Judy, do you want to weigh in on that as well?
I want to echo that. There is increased awareness that is helping with these conversations around mental health. I think it's a little bit of a pivot from the original question, but still relevant that teachers are more and more becoming the frontline people to see and often to implement micro mental health related interventions. Um, and this is a result, in big part, just the natural trend of how mental health illnesses are increasing, and the pandemic still continues to have this after effect, right? There's the aftermath of the pandemic that we're still living to that end. So of course, like there's a greater load on teachers now, in terms of addressing not only the academics, also the mental health related pieces that they're seeing, and there's all this increased knowledge and awareness. Um, to that end, the I also think it's important that we're holding that teachers can't do all of the things, and teachers too within themselves. There's a need for a lot of self compassion in during hard times, that they can't do all the things, and knowing when, okay, this is a kiddo that would be really helpful to, talk to the family about an outpatient provider, or talk with the counselor in the building about, checking in a little bit more, because I think Abby mentioned this earlier, it does take a village. Yeah.
Let's talk a little bit more about some of the things that teachers and parents can do collectively to address some of the symptoms of anxiety and OCD in the classroom. To what degree should they involve an outside professional, and how does that team come up with specific plans for addressing these challenges in the classroom? We talked about communication, but what about the next steps beyond communicating, coming up with an actual plan? Abby?
So at the clinic I work at, we work a lot with school avoidance and refusal, and we take an exposure based approach of how do we step by step start to approach being back in the school building. For some of the kids I work with, they've been out of school for close to a year, and this might involve going to the school parking lot and waving at a teacher. And step two might be walking around in the hallways when everyone else is in class. And I think the communication there with the school that's so important is letting them know what the plan is. I've seen plans go awry where I make the plan that the child's going to go to school, wave to their teacher, and walk out. And the teacher is like, "Oh, you're here. Come into the classroom and let's start doing work." And then it becomes this much more aversive experience that was not according to the plan that I set. And so being able to give like a straightforward plan of so and so is going to go sit in the parking lot for 15 minutes, walk into the building for 20 minutes. If you see him, wave and say hi, and then he'll head home and we'll send a new plan tomorrow. You don't have to do anything else other than that. So I think being really clear with the communication and what the plan is exactly is helpful. And similarly, on the other side from exposure, we all need distress tolerance skills sometimes when emotions are really high. So, communicating that the plan is if this person is experiencing panic and they feel like they cannot do the exposure sitting through it, they'll go to their guidance counselor's office and they'll use these three coping skills. They know the plan. I just want to make sure you know it too. So, I think as much as I can, I try to create the plan on my own, so I'm not burdening the school with it, making sure they're okay with it, and then kind of setting it in motion and CCing as many people as needed on that.
And does that approach change if the concern itself is not school refusal or even school anxiety, but instead anxiety and or OCD that manifests itself in the classroom as it manifests itself at home, for example?
Great question. And so I tend to try to take a similar approach of making a plan, making sure it seems doable for the teacher. So if they're getting really stuck with the homework, can they plan to hand it in with the 2 questions done and you grade just those for right now? Because we're trying to increase this from having no homework graded. And what I really try to do is make the plan in advance so that there's not too much burden on the teacher and make sure that they're okay with it. So I'm not changing, like, can they pace back and forth in the classroom and sing a song or something to help calm their anxiety if that is not appropriate for the classroom or for what the teacher wants? And when possible, I think this is harder with communication. If we can have a meeting with like kind of all the stakeholders involved, I think that's the ideal. So we can talk it through, figure out what works for you. Is getting an email from me every day too much? Do you want a weekly email? Do you want more communication, less? Like what works for everyone involved? That's the ideal and can be hard to do with schedules.
Let me ask you both to weigh in on something here. We've used the term accommodations I believe, our last reference, talking about how parents might be inadvertently accommodating OCD or anxiety in an unhealthy way. The term is often sometimes used to also reference when schools have a program in place to accommodate the issues that are generated by OCD or anxiety and how the school might work with them. Can you both weigh in on that? I know that it's sort of a slippery slope, that there are concerns that a school or a teacher might go too far in quote unquote accommodating a particular behavior in an unhealthy way, much as a parent could do.
Yeah. And, so there is an important distinction. I'm glad that you're putting this question up. That a 504 accommodations, this is pertinent to the states, is well, it's not very different, but we are talking about something different than this kind of parental accommodation, typically what the phrases that are used, but anybody can engage in these overly accommodating behaviors. So a 504 accommodation plan is one that is created with a special education team based on an evaluation of where kids are in their functioning, in their ability to access the academics. Similarly, there in the states, there's an individual education plan. So what's important about these is that there's some form of assessment that is done to assess the level of functioning and the abilities and the supports that would be needed to be implemented in a fairly regular basis within the school setting. And 504 accommodations could be for a kiddo struggling with anxiety or OCD. It could also be a kiddo who is in a wheelchair or has asthma and needs their inhaler to be in the nurse's office. So that's important, right? Because if you think about the purpose of it, what we're saying is this intervention needs to be put in place in order for this student to be able to access the academic curriculum and engage socially just as well as their peers. And what's nice about this 504 accommodations is that they are meant to be revisited. That's where there's this intersection between the 504 accommodations and those like accommodations that you see that even a therapist might do. They're meant to be temporary accommodations. In some cases, they would be permanent, like the inhaler, right? But they're really meant to meet the immediate need. One question that I like to put out there for educators and for counselors is they're thinking through accommodations they're putting in place. Is this accommodation helping this child move forward? Is this accommodation helping them move towards from dependence to independence? And how do I know when it's time to remove it? And those are really good questions, even for parents. So I can remember working with kids that have selective mutism, and that the only way that they would speak was by holding one of those kind of empty paper towel rolls and speaking through it, whispering through it. And that was the step they needed in that moment in order for them to work up to speaking at a louder volume. and not needing it, right? So those questions of checking in, like, is this step actually helping them move forward? When is this kiddo showing an ability that they actually can meet the expectation without this accommodation? And let's revisit this plan. Schools do this regularly, every 6 months, at least once a year, it's meant to be done. And I encourage also parents to be thinking about this as they're thinking about some temporary accommodations that they need to do. When do we know that we need to remove it? When is it, when's the kiddo ready? When do they have the skills? And that probably is less than 6 months, right? Yeah.
Abby, do you want to add to that?
Truly, I couldn't have said it better myself. I was thinking in my head of all the different points I like to make with accommodations, and Judy said them all. And so I think just to echo, accommodations can be so necessary and important. And this idea of it being a moving target that as improvement, and we should see change and growth and improvements happen, that we can shift the accommodations that are given so we can meet the child where they're at.
I want to zero in on the perspective of a clinician right now. We have a lot of clinicians in our audience today. If I am a professional treating a student, a K-12 student, for OCD or anxiety, without necessarily involving the teachers, to what degree do I need to build into exposure therapy, for example, issues that come up during the school day? And how is that best facilitated?
So I think that there's typically two lines of approach I do when the school's not involved. One is to practice some of the exposures that might come up in school in our session. And so we have a group-based program which makes this easier, but taking a test, doing homework in session, giving me a presentation, asking questions, advocating for yourself. In our sessions, since we're in person some of the week, we can actually go different places and try out these skills. Like if you have social anxiety, asking 3 different questions in a grocery store and slightly inconveniencing someone in an appropriate way and things like that. And I think the second piece of this, which is a really important part of cognitive behavioral therapy in general, is assigning homework. And so assigning exposure homework and then discussing it when they come back in for session. So can you go to school and let's say this is a child who's really afraid to ask their teacher anything? Go to office hours and talk with your teacher and ask 2 questions, and then let's discuss it when we come back to session. And the part of the thing with homework is that even if they don't do it, being able to talk about what gets in the way is helpful too. Was anxiety way too high and we need to make a new plan? What came up for you? Being able to increase that emotional awareness and actually practicing these skills. So I think that exposure homework piece is just really key. Since if we only practice skills in sessions, kids get really good at doing a presentation for me and advocating to me, and less so outside of the session.
I'm watching you both nod to your heads as you're listening to the other speak. Judy, did you want to add anything to that in terms of what clinicians might do for working in these exposures, for example, into the classroom?
Yeah, yeah. So, Abby, I think hit all the points that I would as well. And one of the things that I would add or emphasize is how when we're assigning action plans, where we're assigning those like practices, we really want it to be in the areas of that child's life that are so meaningful. So, of course, we're incorporating school. And that's a different way to look at it, is that exposures are not just like a way to torture people. The idea is that we really want kids, teens, and adults to be able to live their best life and to do so meaningfully. So it's only then natural if we hold that perspective that whatever practices we're thinking about would be ones that are specifically going to be done in the school setting. It does get trickier with younger kids, though. When you're talking about just having a younger kid just, say like practice speaking to a peer or asking like, question bingo, doing that in the playground, like you can still do those things, say for a kid that has social anxiety. They're going to need a little bit more support, and that's where it can be helpful to just even cue in a teacher. Yeah, for younger kiddos in particular, that practice is going to need a little bit more support.
Abby, let me hit you with a specific question from a parent. Our child has always been told that they are bossy in school by teachers. We believe her anxiety and OCD are very closely related to rigidity in rules, making sure that friends do what they are told, tattling, etc. How can we work with all that?
Mhm. Oh, that's a great question, and also demonstrates all the different ways that anxiety and OCD can show up. So anxiety and OCD tend to really like things like Judy was saying before to be black and white, clear cut, sticking to the rules. OCD, we often talk about it as making a lot of rules about life that make things feel so much more restrictive and difficult. And so, in terms of this, I think first of all, communicating with teachers so that they have more awareness and empathy about what is going on. That probably for this child, they feel just stressed, like having to stick to the rules. There's often confessing with OCD, like having to tell someone anytime you break a rule or someone else does. It typically doesn't feel good to have to like stick with all this like rigidity. And it feels like anxiety and OCD is making you have to do it. And then working with the kiddo little by little, how can we practice doing this differently and raising some insight around, is this getting in the way for you having to tell the teacher every time? What are you worried about might happen if you don't tell the teacher? And of course, also distinguishing between what is OCD telling you you have to do and what is your own values and things that are important to you. Because I would never want a kid not to tell a teacher or a parent if something's going wrong, and OC sometimes will make it so you stay out 1 minute later at recess or ignore the teacher for a moment, and now we have to confess and apologize too many times. And so starting to distinguish between what is OCD's voice and what OCD is saying, and what are my own values, the things that are important to me.
Judy, we had a question come in about panic attacks, and I know we've touched on this very briefly in terms of some of the anxiety spectrum issues that can come up. What should we know about panic attacks as they may happen in the classroom or at school?
Yes. So panic attacks, they can look very scary. I think that's like what it's probably what we visualize. And something very important for us to know is that panic attacks in themselves, they are not harmful. They feel really uncomfortable. I'm not going to deny that. There's that really high accelerated heart rate, this feeling of dizziness, the nausea, this hyperventilation that can come with it. All of these symptoms are incredibly uncomfortable and they tend to max within a few minutes. It's important to remember that our bodies, we can't hold that state forever. And what you might find as an adult in responding to that is that our urge is just to kind of try to make it stop like as quickly as possible, bring this kid to comfort as best we can, when unfortunately we might inadvertently be reinforcing this idea that this kiddo cannot handle the discomfort that comes with the panic attack. We all will have experienced at least one panic attack in our lifetime. That's the stats show that most people will have. And we're here, right? So I think like that's the number one message is that like, we can have a panic attack. We can feel those symptoms. And in fact, over time, what the message we can send also to kiddos that struggle with panic disorder is that they can handle the symptoms, they can write them out. And what will happen over time is that there will be less fear about those symptoms. If there's less fear, there's less avoidance, there's less interference. Now, some key pieces, though, to note is that with kiddos that struggle with panic attacks or that have panic disorder, they will often ask to go to the nurse. So, this is actually where tapping in nurses into the interventions is going to be critical. Um, in the classroom, you may not even notice that's what's happening. Kiddo's having a panic attack, or kiddo may not even be ready to write out. Like if they say they're working with a therapist, or working on, we're writing out these panic attacks. They may not be ready to do it in the classroom, but they will ask to go to the nurse's office. So there are, if there are nurses who are listening, like some tips here is that like yeah, it makes sense to be able to provide some comfort in those moments, and let's be intentional and deliberate. Okay, so how can we allow this kiddo to, we can say, yeah, okay, that's really tough. Like I see that you're having a hard moment. I'm gonna give you some time instead of intervening further in that moment of heightened physical arousal, which actually, and sometimes it can actually exacerbate the panic attack. And in other occasions, again, like, yeah, maybe kiddo starts to calm down very quickly, but then they rely heavily on this external form of support, and this belief that they, on their own, they can't feel discomfort, right? So for nurses out there, I want to encourage you to yes, like respond. And also, we want to encourage kids that they can feel this discomfort, they can write it out, and even after they've experienced it, kids can have these residual physical symptoms after a panic attack. That's important. They can still return to the classroom. So, and again, I think Abby spoke about this earlier. Is our urge is to rescue. So we may feel like, oh no, kiddo needs to stay in the nurse's office until there is no, physical discomfort whatsoever. But we're reinforcing avoidance of the potential environment that may have triggered the panic attack. So we actually want to have kids work towards returning as quickly as possible to the classroom. And hopefully, if they're having a panic attack in the future, stay in the classroom, write it out.
And a quick follow-up on that in terms of how a clinician might help their patient navigate all that. Is it appropriate for a clinician and or parent team to work with a school nurse and or the teacher in the classroom himself or herself in terms of educating them about how to help navigate these panic attacks?
Oh, absolutely. I would say that it needs to happen. And similarly, actually, even when there's are other concerns around anxiety, nurses have a really big role often whenever there are physical symptoms. It's not just with panic attacks. And I think that like have even just a small note that everybody has about what is the goal in this particular week, what is kiddo working on, and how specific individuals might respond. Say like a nurse will have kiddo in the office for 5 minutes post panic attack, and we'll have kiddo go back into the teacher's classroom. Teacher will respond by, praising them for coming back in, and student will return to, class. Parent will be informed so they can do a check-in at the end of the day, right? Like so, even something small. But yes, to your question, nurses definitely should be a part of that team.
Abby, let me ask you about phobias. Again, also sort of under this umbrella here. What should we know about how phobias might come up in a classroom environment? Again, that's not necessarily related to school, but just in that setting as well, phobias might become an issue for a student.
So, phobias or specific phobias, any specific thing that you're afraid of that then starts to interfere in your life and cause high levels of distress. So, like, I don't like spiders. I would not be happy if there was one in the room with me right now and I could ignore it and continue giving this talk. For people who have like a phobia of spiders, they might not be able to go in woods and long grass. They might have nightmares about it. We thinking about it all the time. And so it's when there's that heightened fear and it's interfering in your own life. And so we see when a kid has a specific phobia, yes, these can come up in school. I think two of the common ones that I see are emetophobia, which is fear of vomiting, which is actually a really common phobia, this kind of feeling of losing control. Kids won't eat in school. They'll be afraid of other kids who might get sick, be afraid that they themselves might get sick and then refuse to go to school or be unwilling to go to school. And the other one's agoraphobia, and you don't have to remember all these big names. And agoraphobia is basically fear of like being trapped or where escape might be difficult, or where leaving something would be feel really embarrassing. So a lot of kids who start to feel more housebound because they're so afraid of being on public transportation, at school when their parent drops them off and goes to work and can't pick them up, at a concert, any place that might be hard to leave. And so a lot of the kids we work with at the clinic that I'm at have both of those fears, and it definitely impacts the school environment. And being able to practice exposures of being at school, even during flu season, if you have this fear of vomiting, or being able to leave home in the morning and go to school, even if a parent isn't nearby and able to pick you up right away, or without texting your parent like every hour of the day to check in. Being able to practice these things in the school environment is so important. And so I think this goes back to generalizing all of these different skills in the main environments that kids are in, and school is one of those very main environments. Mhm.
Judy, we've talked about parents, we've talked about school nurses. I'm thinking about other people on campus for K-12 schools, coaches. What thoughts come up to you, come up for you in terms of this conversation, relative to kids and teens who might have issues with anxiety and OCD that will manifest themselves in the sporting world?
I think our coaches, just like also like administrators and assistant principals, like they may seem like they're a little bit more peripheral to this process, but they are not. And I think coaches are a really good example of that. Another the kind of environment or domain where kids put so much value. It's such a meaningful part of what they do. And I think for coaches out there, of course, they're going to have their kind of their approach, their model in helping kids build up skills in order to perform well in the sport. And naturally, anxiety could come up and get in the way of that. So they might see it in ways of like how any particular kiddo is, a part of the team or not a part of the team, or any positions that the kid wants to hold or doesn't want. And I would say that the approach is actually very similar as to any other role that you might see inside or outside of the school. You're really trying to balance, what is this child capable of doing in this moment? How do I get them to kind of, stretch a little bit outside of their comfort zone? As a coach, they might see it more in their sports related performance, right? But it may show up in more subtle ways. Kids that are missing practices, or kids that, are asking to be tapped out when things start to get hard on the field. So being on the lookout for those pieces, and being aware and acknowledging that it could be mental health related, it could be anxiety that's getting in the way. So we're also doing those quick checks with the students themselves, and if they have an opportunity, with families.
And I think this is an area where stigma is also really important to talk
Yeah.
about. Since for so many student athletes, there's this idea of be tough, get through it, train the hardest, be the best. And so I think also being able to have examples like, for example, Simone Biles and people who have talked about like mental health as an athlete and how an awareness of this also complements being a top athlete. So I think that's just an important piece since for a lot of student athletes I work with, it feels a little harder to acknowledge when you need help, and to kind of talk about how this affects playing sports. Talk to your coach about it, if there is a culture of kind of like toughness, and things like that.
So glad you mentioned that, Abby.
Yeah, those are great points. I want to, as we kind of run out of time here, I want to talk a little bit about getting started for a parent from a parent's perspective. This can all be a little overwhelming. I mean, your son or daughter is showing behaviors that give you pause. Perhaps you've even reached out for professional help with a therapist, but you really don't know how to handle this piece with the schools. What are some practical first steps that a parent might take to engage with a teacher, to engage with a school, to work with the clinician in a constructive way to help their son or daughter navigate these challenges during the school day? Where's the starting point?
The starting point, I would say, is that email. Usually, we're emailing nowadays, caregivers with teachers. I would say that it's that initial email and trying to schedule a time. And if the parent teacher conference date is too far away or already past, scheduling another time to have a conversation and to share your observations. I think like that's the number one. I think we spoke about that a little bit earlier about opening up that path to communication. Um, and then I think other pieces that are important too for folks to know in the States in particular is that when you start that conversation, then it also helps start a lot of the process with assessment and meetings and reconvening as a team to consider the supports for kids in the school. So literally that email is the first step.
Abby, your thoughts?
I agree. I think opening up communication and beginning to talk about this process. And I think the step even before that is talking with your child. I think as a parent or caregiver, it's so hard to see your child in distress. Sometimes we don't know what's going on or what they're feeling, and trying to start having some of that curiosity, hearing what they need, what they feel. Some kids share a lot, some kids keep it all inside, and starting those conversations with them. Would they be willing to see a therapist? Can we talk to your teacher about this? And then reaching out to the school. I said this before that I'm a broken record, and I think just communication is so vital that so many things go unsaid. And like Judy was saying, most people want to do good, they want to help as long as it's within their bandwidth.
Let's talk a little bit about resources for parents and for clinicians and for teachers, for that matter. Let's break those down into three different areas. Let's start with the teachers. If an educator wants to learn more about OCD and anxiety, what do you suggest in terms of possible training for them?
Actually, in the McLean School Consultation Service, we provide professional development to schools. I do want to start kind of with that, in that we cover a whole bunch of different topics with a lot of practical strategies that teachers, clinicians, and even administrators can use in the school environment. And in addition to that, there are other resources. So the International OCD Foundation, for example, has the Anxiety in the Classroom website that folks can look to, and it has resources for parents as well as for teachers and also for students. So I think I'll leave it there. And Abby, if you wanted to add anything else.
I think the IOCDF website is excellent, the anxiety in the classroom page. I also think the Association of Depression, the American Association of Depression and Anxiety, ADAA is the abbreviation. And it's those words in some order, as well as the Association for Behavioral and Cognitive Therapy, ABCT. Both have different blog posts, web pages, book recommendations for work with kids within the school setting.
And clinicians who might want to learn more about specific challenges in the school setting for their patients, where would you point them?
So I think similarly, these websites have different resources for clinicians, and the things that I would just highlight for anxiety and OC in particular is anything that describes exposure and cognitive behavioral therapy. That those are kind of the gold standard therapeutic interventions for anxiety and OCD, and so looking for those two areas to be highlighted to make sure this is evidence based recommendations. These are evidence based recommendations.
I'll add one more website here for clinicians in schools. There's the Attendance Works website, which is incredibly powerful and has a ton of resources for schools who are trying to figure out their own systems around chronic absenteeism. And as we mentioned, chronic absenteeism or avoiding classes are a manifestation of a ton of mental disorders, including anxiety and OCD. So that's another good resource.
Our time has just flown by. Abby and Judy, thank you both so much for your time and your expertise. We very much appreciate both. Such an important topic, and we really appreciate your sharing some insights as to how parents and teachers and students and clinicians can all work together to address them. So again, thank you.